How are you? Now, does Arlie have any disabilities that we're aware of?
As far as I know, no. Right?
As far as I know.
Right.
Okay.
What? How are you? It's hard enough to find a baby that's specifically going to show up on a Monday morning, much less.
Oh, I know. I just want.
And unfortunately, so many infants too. If there are issues, the parents usually at this stage are still so much in denial because most pediatricians are looking for medical.
Right.
How's the heart function? You know, they usually come in swaddled or in a car seat. You know, what's blood pressure? Okay, we're good. How's he eating, Mom? You know, is he sleeping, burping? You know.
And so this is doing your hearing thing right there. Because she was completely engaged with Michelle. I mean, Michelle should have was talking to her in her little mind, and she was completely engaged with her. But that's what we did. What on that video that we didn't talk about.
You think so? You think so? Anything, by the way, that we're talking about, we're already making changes. So, you know, please don't feel like she's being evaluated per se today.
Fine.
Okay. And I got right to work because with the babies, you know, I'm on hard temperament right now, so she might get hungry within like 15 minutes of working with this. They get really hungry.
And so, what do you tell me? What
So,
you're doing?
so what I'm doing now, and again, normally I wouldn't talk like this in front of a mom per se, because again, but I'm noticing already that she moves more to the right than she does to the left. So this is her pelvis going to the right and to the left. Right now, she's a little bit, see where I can't go past, a little bit towards midline. See how she's much more engaged going to the right as far as the pelvis goes. So already, if these patterns aren't changed, she will sit up towards the right. She'll do everything towards the right. Now this could be because her crib is against the wall and the way she reacts to the stimuli that she's already setting up as people come in through the door to her room, or the way the bed's set up. It could be the way that maybe she's nursed or fed more to the one side. That happens more often if a child's bottle fed versus nursed, you know, because they don't get that, you know, then the mom will do usually right-handed, so the baby's this way and the pelvis will adjust.
Thank you for sharing.
Oh, yeah.
Yeah.
We're pretty relaxed. My degree is in elementary education, so I'm
Oh,
like,
cool.
yes, early everything. The earlier you find out anything, the better chance you have of.
Well, just redirecting it. That's
Yes.
all, yeah.
Hello.
And that's the thing is, kids that are hearing or visually impaired aren't covered under services in Arizona. It's a separate program, and they don't always get caught right away. So we're trying to find out how we can deliver a program that where parents, if they have concern, get help earlier versus later. So there you go. So now her pelvis is already
Do you see
starting
how
to
gentle
go.
what she's doing? Can you see her hands
Yeah.
good enough? Yeah, it's just so gentle.
There, and now her feet are starting to come up, because that's another thing. Her feet were kind of on the long side, so the pelvis, had tilted the pelvis, like right here. I can't tilt her pelvis. And there she goes. Okay, thank you for listening.
Good following directions.
Well, babies just want to move. And when they can't, they just won't. So again, a child that's visually or hearing impaired, I know, is not going to get, look at all the counterbalancing that's going on. And now mimicking, I know, because I make weird faces when I talk.
She's got her hands way down. That's when she talks about the diapers being kind of a nice shield that she can work on some things. I know, you're the center of attraction. Yeah. Right, Jack.
And I bought play toys for you in the background. So now that I worked with her pelvis, I'm slowly going to go up to the chest cavity and see how that's functioning.
And what typically should that be doing at this stage?
At this stage, everything that she's doing here, as she looks up here, you'll see a counterbalance happen through the pelvis all the way to the toes, even through her hands. So just to hold her head in this position, now again, she can be in a car seat, I get it, and be restrained, but this is what a baby should be doing. The more and more she gets engaged visually, she'll get more and more engaged with her body functions. Now this will settle down. Obviously you can sit through a meeting and you don't need to do all this and you can pay attention. But as far as a baby's concerned, because now she's learning proportions, eye hand, all of this going on just from you doing this. However, if she was restricted in any way, if I just held her down, already look at how it changes the arm movements. Just from that, look at the difference. So if I just let her go, give her a little, letting her know that she can do it, and now already see the counterbalancing starts to pick up again. So this is what happens as more and more where the babies are getting restricted, putting bouncy chairs, seats, all of that starts to happen, and that's why you're seeing such an increase in delays going further, sensory integration disorder, because of these patternings. They're more restricted. They already have, let's say, slight issues. You're limiting their movements even more. They're doing what they can with what they have, but it starts getting more and more limited. So that's why you're seeing such an increase in children having developmental problems that you didn't see maybe 20 years ago. But we didn't have car seats, we didn't have all of these, you know, we had buggies versus the strollers, and now these little car seats, it's from the car to Walmart where you used to have to take the child out to present. I'm not saying don't use your car seats.
No, I understand.
But
It's just for everything. In the car, it's fine, but then take them out.
also we're laying the babies on their back, so all of these are
Not enough tummy time.
causing developmental issues. Well, that tummy time is a pre-crawl. You know, when you're lying here, again, if I were to restrict her, see already how that changes the pre-crawl. I know. I'm just doing it for a second just to prove a point. See, now I've just restricted her, and look at already the difference. And then she'll start to kick in because she's healthy. But again, a child that has issues, they're stuck in a sense. I know. And now there you go, your back's curling a lot more. You can get those feet to your mouth. That's very important. It is, it's very important. But most people in early intervention, if the child's not sitting up or milestoning that way, then we suddenly have a problem. To me, I can see a problem within a week to a month old easily because of these little finite movements that are just overlooked as being necessary. But again, if she's visually impaired, the same way I restrict the pelvis, her head's restricting that movements, and you'll see the same functions where you're going to see the lower movement vocabulary being established in the infant because they're not responding to stimuli visually or auditory.
See, and this is the kind of stuff, exactly what you're saying now, that I see on that little video. I mean, that should be on the video.
Oh,
You're
absolutely.
explaining all of it, the whys and the...
Or right now, we're just trying to establish
Right.
protocols, and that's why we're meeting, and then hopefully, but yeah, no, that's where I want to go with
Right.
all of that. I've got enough video for, you know, and I have no problem setting it up, you know. I'm offering to track a child with special needs every week until, you know, they're a year old right now, and they'll get totally free lessons just so I can
okay.
do this kind of setup. And this way too, we can do, once the videos are set up, you can do much more in-house training, and it'll be backed also with further things that can be done. Like instead of just saying, if I restrict the pelvis, actually I want to teach parents how to come in and start adding mobility to their baby. If you have any questions, feel free. Now her back's kicking in. She just did her first little baby back bend. See right there, pelvis is tilting forward.
Is the pelvis being off at the beginning, would that explain why she looks one way versus another more?
Absolutely.
Because I watch her when she does tummy time and she'll turn her head one direction versus the other.
Right.
much
Which
more
you would do
frequently.
too. If I
Right.
ask you to lie down on the floor, your head will automatically go to the side that's, quote, more comfortable. But see, that you're an adult and you have muscular conversation. She does not. So a baby, that's why we go into airplane or should go into airplane, because they are not set up yet right-sided, left-sided. And when you start to see those patterns happen, now it could have been vice versa. Her pelvis could have been restricted and that's throwing her head off. It could go both ways. But you want a 2-month-old to be neutral.
Yes, yeah.
And-
I kept telling my husband, I think she turns her head one way versus another more. And I was thinking, that's not normal, like, that's not, it's not balanced and necessarily right. I mean,
Yes, now I'm gonna go to, see now all this, she's not lifting the head at all. So now I'm gonna kick in that and see if she'll let me, but she might be getting a little hungry. This is a real workout, so they can get a little, there we go. So now the head's starting to kick in just that little bit. So she was getting frustrated, just like a baby would in tummy time.
So
On
it's
her
just-
back, she was getting frustrated because she couldn't react to the stimuli the way she wanted to.
Okay, so she's helping you bring her head up?
I'm actually helping her, but I'm doing it in a way that she doesn't know the difference that she's not doing it. And that's why it just changed. There we go,
That's-
see?
yeah.
I know you did it. Yeah, see, and now the head and the feet are coordinated just from that little bit. And again, would it matter to her? Maybe not necessarily, but this might be the difference of her, being a high-end performer, because all of a sudden now it's kicking in her feet with the head at the same time at an earlier age versus her trying to figure it out when she's older. And now what I'm going to start doing if you notice too, her left arm's lagging just a little bit. So I'm just going to come, I don't do hand over hand. There you go. But normally I work so quick I don't even have to explain all of this per se because it's just happening.
Is that funny? Huh? Is it funny?
And due to the power of YouTube, even with that video, I've asked people if they'll translate it for me. And I already have like French, German, and Arabic picking up, just to get it out. And that's just from 12 hours of asking. See already how the left hand, now again, I'm going underneath the back to stimulate all of this. Most people don't realize too, if the diaphragm's not organized, the vision's not going to be organized. Diaphragm is crucial in vision function.
Really?
Yeah. And Diane's seen it. She used to say, oh, there goes Miss Michelle with the magic button. And literally you just see the eyes pop on when the back organizes through the diaphragm.
How is that connected?
Because it's a system function. And when the fascia tissue or whatever it is,
See, we always said it was the neck.
there we
It
go.
was the neck. The
I
neck was-
know.
Oh, I'm sorry, I'm not doing my
I
job.
know.
I'm not
Hey,
doing my
you.
job. You just
Yeah.
do it by yourself. Yeah, we always thought it was because their neck muscles were either too tight or too loose, and it isn't. It's the whole ball of wax. Oh my goodness sakes! Are you ready for something new to look at?
So now bring it back down just to see how that feels. Is your neck different now? Yeah? Is it all different? I know. See how your back is swaying too? It is. It is. Oh, she's got new stuff. Can you come on this side just to give the variation?
Do it on that.
Okay, well you can do what you want then. The plate's prettier than I am. It is. It is. Oh, very good. You're such a smart little girl. Look at that girl. It's real subtle. Can you see the difference in her head moving around? How she actually can bring her chin now up and down versus just the head flat on the ground looking back and forth?
My goodness sakes.
I know, she was just giving you a break, but it's coming back. That plate's a lot. I know.
She's a good baby.
So now even with all of this, I'm dealing with the rotation of the foot because the foot's not rotating properly, then the whole system, she'll never go on her belly, she won't roll, just based off of the ankle mobility. And so you see that with special needs kids because they've IV'd the ankles a lot because it's a good line to go through. And then they put the pulse socks or whatever. So all that time in the NICU restricts the ankle mobility. And so therefore the child can't roll over, so the CP is greater.
Now, did you have any idea that the ankle rotation had anything to do with all that?
It makes sense once you say it.
Yeah.
It does.
Same
You just didn't think about it.
with the wrist mobility. I can't come up to all fours if my wrist can't rotate. So if I'm fisted or whatever, especially like this, can't come up to sitting. I can ask you right now to tighten your ankles and tighten your hands and hold your breath and try and get up. You can't do it.
Hold, say that again.
Tighten your fists. So grab your fists, tighten your ankles up, and now hold your breath. And now try and get up. Feel the difference? So I let everything go. Feel the difference? Do you see the work that you have to do through all of that? So curl your toes if it's hard for you to tighten your ankles.
Yeah.
There
It
you
was
go.
the
So you
curling
can't
of
do
the
it.
toes.
Yeah.
Yeah.
Yeah, because I was so surprised you got up. So again, but you're using mind over matter. But the baby doesn't have that. So you're not. That's where a child with CP is never going to walk when you have those issues. And everyone goes after core strength. Child with CP already has. This child too has enough core strength for an army.
Right. Well, the child with CP, that's all they have is their core strength, I would think, just so
If
that
you
they
don't
can.
want it to.
I know, but I'm just thinking so that they can try and move. They don't have.
How can you try and move? What did I just show you? It's an oxymoron.
I just learned this from being in that boot, that my PT was trying to get me to have my core strength, but my back, I couldn't even stand up sometimes. I go to Michelle, she gets my body aligned the way it's supposed to, and that core strength is just a moot point.
That's why babies aren't born with six-pack abs. If they do, guarantee you, when that rotation's off, I can guarantee you developmental delays, period, the end. So if you can initiate these responses early, I'm not saying you're not going to have CP or genetics or going on, even the blindness and the hearing impaired, you can't change that per se, but you still can change the whole mobility and the function of the system.
She sees you, yeah.
You got your hand. That's more important than me. That's what it's all about. And see, sucking right there, that's working on your wrist rotation. So if a baby doesn't bring the hand to the mouth immediately. Same thing too, that's why nursing is so much more important. Just the pressing off of the breast tissue is a pre-stamp because they're learning that extension through the breast tissue of that contact. So when that's taken away. And again, what I'm trying to do is, she's bringing you nappy. She's ahead of you. What I'm trying to do is, again, what if you can't nurse or you don't want to? That's fine. What? Is that to initiate these little movement factors within the first couple of weeks, whether your child's, you feels okay or not okay, what a benefit to that child.
Such a pretty girl, yeah.
Good.
Yeah. Oh my goodness.
So now She's not used to being on her side, so just working on her internal balance on this side. This is, again, child that are delayed, especially when they're not going over to tummy time. It's this part in the breathing. They hold their breath, and when they roll over, that's where the panic sets in. So it's really important that that baby gets the time on the side. They're learning how to breathe, function the diaphragm, even the head control right from here. Now, so watch her with her head right now, and I'm just going to come right underneath the neck and the head. There, ready, just that little lift. There, see, now she just did it on her own. Now, she's never seen in this position before. I have to hang out here for a while. This is where you really have to watch a lot of therapies, because they'll go, okay, let's do tummy time. Let's do sideline with the head up a little bit. It's okay. She's never breathed in this position with her head in that position. She's never seen. Now I'll bring her back down just to see.
I'll bet you $10.
See already
by
now
this
how she's trying to
afternoon,
lift her head.
Mom's going to have her in sideline position.
But see,
Usually down in
but
there's
see,
a lot.
but see,
Look
just
at
from
the
the head,
difference.
now I can rotate all the way through the pelvis.
And just look at her face, how much different her face is.
Do you see already the difference, how I can rotate the pelvis just from doing that little bit in the head? And that answers your question before, how
Yeah.
just the way the head's positioned.
My goodness.
I'll feel you up before you leave. What I'm doing is just so gentle you go again. I mean, you can tell too she's not reacting. I mean, she's not fussing. Although now that I said that, she'll probably blow.
And she's pretty stubborn.
But when you work with the system's natural
Yeah.
mobility, she doesn't know she's not doing
not
it.
doing things that she doesn't want to do, and so
You can't force babies. That's the
Yeah.
whole point. If a baby's upset, they're being forced.
Hi.
There
Where
you
you
go.
going? Are you going over? Huh?
There you go. So now I'm just watching her for just a second, but I'm going to come under here. Now her head should be coming up just a little bit. She's figuring it out.
it's fascinating. She usually screams the minute she's on her stomach.
Now, does it matter that her left arm is underneath her, or do you want to...
I want her to figure it out. There she goes. She pulled it out.
Were you listening to
And
what
that-
I was saying?
And that's that counterbalance. She needs to counterbalance that pelvis.
Right.
But see, already now she's already going, starting pre-crawl because she's trying to push, she's actually pushing off of her hands. There, see the knees coming up? Babies don't just hang out. Oh, I can do this, that means, but the difference, that's
when
when you,
Matt has a piano to kick, that she's obsessed with kicking, because it sometimes makes a note and sometimes makes a whole song. And when I put her on her stomach, she immediately uses it to launch herself forward and then just lays there and screams. Wow.
because her head falls down.
Uh-huh.
There we go, now the head's starting to, and notice too how with this, her head's getting more mobile going
Yeah.
that way. That's it, push up. I know, why it's a lot of work to be a baby. I didn't say it wasn't.
Where are you going?
Your back has to be a little bit stronger before you start crawling, Lilo.
A few more months.
But see, she's a typical little girl that she's real smart, but you could see already how just that little bit, what a difference in her central nervous system. But she's still not picking her head up as much as I'd like, so I'm going to probably bring her over just to work on it. There, all of a sudden now I said that. Here, I can come over. I know.
Here we go. Here we go. Here we go. Hello. Hello. Away. Away.
Yeah, let me bring her back over. I know, I said, here, is this what's bothering you? That little head can be very heavy when it's hard to lift. It can. And you also could be getting a little hungry. What do you think? Are you okay? All right. That's what hands are for. No?
Is that your favorite? Is that the favorite? Huh?
See, even this right now is a pre-strand. I'm bringing her foot to the floor, and I'm working on the mobility of the pelvis in relationship to the hip joint. And so the foot's working on a pre-stand, having the foot to the table. So that's where you see where kids can't present their feet because they haven't set up these kind of conversations in infancy. Because that'll be extension rolling over where she pushes through.
Now, is she tighter on her left than on the right? Is that?
I wouldn't say that she's tighter, she's different, and you're going to be
Okay.
totally different from your right to your left. So the right lung's larger than the left lung, you know, the heart's not symmetrical. But again, like I said, if the baby is used to being held in this position and just bottle fed versus the left-right, which would happen with nursing, that alone is going to change the pelvis. Or like the mom had concerns with the head only going towards one position, that too will affect the curve of the spine, just slightly enough, but that rotation. So hopefully before she leaves today too, I'll bring her over on the other side, but I'm going to give her another lesson just as in my office so I can work on that as well, just to make sure again she's in neutral rolling left-right. A baby doesn't do anything that's unsuccessful, that hurts, it's uncomfortable, is a force. They don't have mind over matter. They just do it. And if they can't just do it, they don't do it. So that's where you start seeing kids that favor a side or way too early.
My goodness.
And two, even though she got a little upset, she transitioned very nicely out of it. Don't you think?
Yeah.
Yeah, usually being understood is the end of everything.
Two
It takes
hands.
like 15 minutes of comfort to get the crying to stop. She's so mad by the time we're done.
Sakes. Where? Is that a where?
But see how I can let go now and how much more she is balanced on her side.
When she was first born, she could almost get in that position.
Actually,
got
I
it
saw this
too?
great video
Oh my
of an
goodness.
epidural baby
Oh
versus a
my
natural baby.
Uh-huh.
And I don't know how this mother allowed it to happen, but they just put the baby on the belly.
where they crawl
And
up?
it just crawled and latched. It looked at this nipple and crawled up the belly. They had crawling at a newborn. And
Yeah,
kept
we
looking, and you thought the baby was going to latch on here. And all of a sudden, like a turtle, lifted its head and just totally latched on the other side. My husband was like, "You're not getting drugs." That was the most amazing thing I ever saw in my life.
Yeah, we watched a bunch of them
Yeah.
when we did our pre-birth
You
classes.
got it.
Because we did hypnobirthing.
You got
Hypnobirthing?
It's a lot of relaxation and breathing and calmness and. I mean, I had to get induced because they thought I was going to have a stroke
Oh,
2 weeks early, but for 10 and a half hours of labor on Pitocin, it was amazing.
What?
There. Now she's rolling again through the pelvis.
What? What is it? Are you gonna go over? My goodness sakes.
That's it. Just figure it out. Your head's up more.
There you are.
No.
There you
Nothing went
are.
away.
There you are.
Huh? And I'm just lightly under the chest cavity just to see how she counterbalances through the right wrist or hand and then through the left.
What do you
She's
think?
holding her head up.
Oh yeah, she's totally.
What do you think, huh?
I know, this is great.
Wow. Wow.
Hi.
Hi.
This is my argument. I think every kid should just have like 2 lessons when they're born. I want to do a mommy video that you can, you know, just like for birth. That's why I was cranking to knock off this video, but I think There, now she's up higher. There she goes. So the chest is loosening up, and she can hold the head
I
higher.
wish we'd have just put her on her stomach at the beginning so you could see what she normally does. Compared to now. 'Cause she's normally very frustrated.
There she's starting to do airplane. Both hands are coming up. All right, just for a second.
What? What is it?
Okay, I'm gonna bring you back down. Just because the lesson's getting a little long for her. And I don't want to blow you. No, no. That's your hand. You have to feed yourself someday. Yeah, it's just, yeah, that's your hand. You saw it for a second. It's not as exciting as the black and white stuff. And notice too that she's got a pretty decent vocabulary with this whole lesson. She's got a lot of different voices that she's using, even that she's fussing now, but you're getting a lot of the ya-yas and la-las, and she's been pretty talkative. Kids usually too, if they have issues with delays, if they're busy moving, then the voice goes, because their brains can't handle doing both. My son was real good at that. He was. Are you rolling on your own? I wasn't ready for that. I was just going for this side thing. Here, I'll come around you, Diane. It's okay. She's mobile. She's mobile. Oh, you like those suckers, huh?
Well, and when you tell me what to do with your 2-month-old to help them develop, it's like, oh, you can't really do much of anything with the 2-month-old. And I was like, no.
Well, yeah, this is my whole thing.
There are lots of things I can do with her. I'm just not exactly sure which ones to do.
Is that pretty? Is that pretty? To me, this is the most crucial time.
Yeah.
If she's not sitting up by 6-8 months, in Houston, we have a huge problem. And it's so much harder to change her mind.
Oh my goodness. Oh my goodness. Oh my goodness.
And here, as Diane's working with the vision.
Yeah.
Now, too, Diane and I are the only ones in the world that do this kind of combination with movement and vision.